My name is Chris Ching, and I'm a researcher here at the University of Southern California Keck School of Medicine and co-chair of the ENIGMA Bipolar Disorder Working Group, a global consortium of researchers pooling data and resources to study the underlying neurobiology of bipolar disorder. So today I'll be providing a brief intro to bipolar disorder. So what is bipolar disorder? Bipolar is a chronic and episodic illness defined by extreme fluctuations in emotion, mood, thought, behavior, and energy. These fluctuations are severe enough to disrupt an individual's everyday functioning and can require hospitalization. These mood episodes can last days to months and impair one's ability to hold a job, function socially, and care for oneself. And in between these extreme mood episodes, many individuals will return to a normal mood and can function quite well, although some will continue to have lower level symptoms. So people tend to be diagnosed with bipolar disorder by their early 20s, though younger children and even older adults can also develop the illness. It's estimated that about 1 to 3% of the world's population will develop bipolar disorder during their lifetime, with about 40 million individuals diagnosed worldwide. So what are the mood episodes that define bipolar disorder? So mania is a persistent hyperactivity, elevated self-esteem, reduced need for sleep, racing thoughts and speech. You see individuals that are easily distracted, irritable. They take part in risky behaviors, and in some cases they can experience hallucinations and delusions. Now, hypomania is a milder, shorter form of mania where functioning is less impaired and judgment may be intact. Depression is a loss of energy, persistent sadness, social withdrawal, low self-esteem, trouble sleeping, and individuals may experience suicidal thoughts. Mixed episodes are where individuals experience aspects of both mania and depression simultaneously or in short succession. So for example, an individual may have elevated mood while also experiencing suicidal thoughts. Now, euthymia is the term that we give to relatively stable mental or mood states where an individual is neither manic, hypomanic, or depressed. So as I mentioned before, people with bipolar disorder can experience periods of extended stable mood or euthymia between these more severe mood episodes. So are there different types of bipolar disorder? Bipolar is thought of as a spectrum of related disorders. So individuals with bipolar disorder can experience a variety of symptom profiles. And there are several categories that are currently used to characterize different types of bipolar disorder. So this includes bipolar 1, in which individuals experience at least one manic episode. And while it's not a requirement to experience a major depressive episode for bipolar 1, this is often the case. Bipolar 2 is where an individual has experienced at least one hypomanic and major depressive episode. Cyclothymia is where individuals have mood instability for at least 2 years with both hypomanic and depressive symptoms that don't meet the full criteria for mania, hypomania, or major depression. Now, there are other types that appear to be caused or brought on by, for example, substance use, drugs and alcohol, or other medical conditions like stroke, multiple sclerosis, etc. So why do people often or sometimes receive different diagnoses over the years? We know that an early and accurate diagnosis is really an essential step to providing patients with a treatment plan that has the best chance of bringing their symptoms quickly and safely under control. So unfortunately, on average, it can take the better part of a decade from when an individual first begins experiencing their symptoms to when they are properly diagnosed, which significantly delays effective treatment. So about 70% of individuals with bipolar disorder have been misdiagnosed at least once in their lifetime. And part of this delay has to do with the challenge of diagnosing mental illnesses. So unlike other medical specialties where physical exams or laboratory tests like blood tests, imaging, genetic screening might be used to diagnose and determine a treatment plan, no such biomarkers exist to diagnose mental illnesses like bipolar disorder. And so when it comes to mental illness, a trained clinician like a psychiatrist or psychologist will conduct an in-depth interview with a patient to determine whether their particular signs and symptoms and the severity and duration of those symptoms fit into established diagnostic categories. Now, the symptoms of bipolar disorder can overlap with other psychiatric illnesses. In fact, we know that most individuals with bipolar will also meet criteria for another psychiatric disorder. While the most common misdiagnosis for patients with bipolar disorder is major depression, the manic symptoms can resemble those experienced in attention deficit hyperactivity disorder, ADHD, and the more severe delusion and hallucination symptoms that can come with mania can overlap those experienced by individuals with schizophrenia. So these diagnoses can have significant implications on which treatment plan might work best for an individual. Now, we know that some treatments can be effective for different psychiatric illnesses with overlapping symptoms, but a misdiagnosis can lead to a suboptimal treatment plan and potentially delay recovery. In some cases, it may actually make the symptoms even worse. So, a major goal of research is to understand the underlying biological causes of bipolar disorder so that we can develop more reliable biomarkers that improve the speed and accuracy of diagnoses and hopefully allow us to design more targeted and mechanistically relevant treatments. So, what are some of the most effective and evidence-based treatments for bipolar disorder? Medications and behavioral and cognitive therapy are effective frontline treatments for bipolar disorder, and there's a variety of medications used to treat the illness. It's common for those with bipolar disorder to be taking multiple medications at once. People may have heard of medications like lithium, mood stabilizers, antipsychotics, and antidepressants. These are general categories that represent a wide array of medications that modulate a range of brain chemicals and influence the way brain cells wire and fire together. So behavioral and cognitive therapy, or sometimes known as talk therapy or psychotherapy, has been shown to be quite effective, especially when applied alongside medications to help patients identify and change troubling thoughts, emotions, and behaviors. And so some people may be familiar with some common forms of these therapies, from cognitive behavioral therapy to interpersonal and social rhythm therapy, cognitive and functional remediation. There's family focus therapy and psychoeducation as well. Now, in certain uncommon situations, when patients don't respond to medications and other evidence-based treatment plans, ECT, or electroconvulsive therapy, has been used to improve severe symptoms of bipolar disorder, especially in an acute or potentially life-threatening episodes. So ECT uses a controlled electrical current applied to the scalp of a sedated patient to cause short seizure activity that appears to induce subtle remodeling of the brain's circuitry. And there's lots of important active research into the exact mechanism of how it helps to rapidly alleviate symptoms. But importantly, the procedure is safe. It can be highly effective in certain cases, and it really bears little resemblance to the inhumane portrayal we sometimes see in movies and popular culture. Now, given that this is a very brief introduction to the topic of bipolar disorder, I won't be discussing a very important consideration for all treatments, and that's the ever-present and potentially detrimental side effects that can come with these treatments. Now, we know that the side effects from some of these treatments can affect an individual's health in complex ways, and the side effects can make it very challenging to continue a treatment plan, and again highlights the need for a better understanding of the underlying biological mechanisms of this illness so that we could build more targeted treatments that limit those side effects. Now, other areas of active treatment research, though not yet part of the established treatment strategies of bipolar disorder, include neuromodulation, or the use of non-invasive brain stimulation techniques that modulate brain activity, as well as psychedelic agents that may also help to modify brain circuitry. So, in wrapping up, I want to provide just a very brief summary of some of the major lessons we as researchers have been learning about bipolar disorder over the past several decades. more and more evidence suggests that bipolar disorder is a mental illness related to alterations in brain regions that are important for emotion and reward processing. As I mentioned before, although no laboratory test exists to determine if someone has bipolar disorder, research is showing that on average, individuals with bipolar appear to have subtle alterations in brain structure, function, brain chemistry, inflammatory and immune response markers, circadian rhythms, as well as cellular metabolism. So there's a growing understanding of the many risk factors associated with developing bipolar disorder, but we still really lack a clear understanding of how all these complex pieces fit together. Now, genetics is a major driving force in developing bipolar disorder. Those with a family history have an increased risk for developing the illness. In addition to that familial risk, researchers are finding subtle differences in the genetic code from person to person also appear to add to one's risk for developing the illness. Importantly, these genetic variants appear to influence the way brain cells develop and communicate with each other. And so we're really just beginning to unlock the complexity of how these genetic risk factors interact with an individual's environment that then leads to these alterations in brain structure, function, to changes in those inflammatory and immune markers, to altered cellular metabolism, to disrupted sleep cycles, and ultimately to the mood symptoms that are the hallmark of the illness. And so just to end on a positive note, there are a great many researchers from around the world that are working on improving our understanding of this illness. This is our own effort called the ENIGMA Bipolar Disorder Working Group. It includes over 200 scientists pooling existing neuroimaging, clinical, and genetic data from across the world so that we can build large-scale, ancestrally diverse studies that will help drive consensus scientific findings and hopefully new insights into the biology of this illness, all with the goal of improving diagnosis, predicting who might be at highest risk for developing bipolar disorder, monitoring the severity or illness progression, predicting optimal treatment or therapy, and ultimately helping to improve the quality of life for those living with bipolar disorder. Thank you very much.